Welcome to Ponchatoula Live. It's 2022. We have our first show of the year, and I'm so glad to be back after our holiday break because I've got us a fantastic guest here to kick off the new year. She is a wonderful mother, an outstanding professional, a woman of faith who helps others through the grieving process, and much more. She's just one of the most interesting people that we've had the opportunity to bring on the show yet. So, with no further ado, Pamela White, welcome to the show. How are you?
I'm doing well. How are you this evening?
I'm great, and I want to thank you for being here. And why don't we kick off with you just telling our viewers a little bit about yourself?
Absolutely. Again, my name is Pamela White. Was born and raised in the great city town of Albany, Louisiana, where we had just a one red light, and but it was great being there. I grew up, graduated from Albany High School, went on to get a degree at Southeastern, my undergrad at Southeastern Louisiana. Many years later, I went to Southern University and obtained my MBA there. And in 2016, I was grateful enough to receive another master's in professional studies from Tulane University.
Oh wow, double masters. That's really
Yes,
impressive.
yes.
And you mentioned you graduated from Southeastern first. What did you study there?
Business. My undergrad was also business.
Okay, wow, what an impressive resume.
Yes.
So do you attribute your academic success, having three, higher learning degrees, to the foundation you got at Albany? Just natural smarts, a bit of both. What do you think's been the key to being so accomplished as an academic?
I would have to say Albany was a great school, and it still is to this day. I will also, it was just my drive, my motivation. I'll have
Uh-huh.
to say and just be honest with those who may be watching at this moment. Neither one of my parents graduated from high school. And so just growing up and having to have the intuition to be able to learn how to do things on my own, whether it was just making certain that I pay attention in class so that I would know how to do things, because I could not get what I needed from my mom, who was actually living at that time. So it was just, I had a drive. I had something in my mind that I wanted to accomplish, and I just
Yeah.
continued to pursue it.
Well, they must have been so proud of you to see you do that when they were still with us, because, we had Judge Jimmy Coon on the show a number of episodes back, and he told kind of a similar story. Obviously, he's a very accomplished man with a great education and kind of a brilliant scholar type. And but his parents had very limited education too, and I know it meant a lot to them to see him and his siblings, because he was one of a ton of kids. He wasn't the only one to go on to big great things. And of course, we see that story in so many families, and I would imagine your parents are, very proud of you,
Yes.
and that's really neat. Well, tell us what it was like growing up there. I mean, what was Albany like as a kid? You mentioned the one stoplight. I think those of us that grow up here in Ponchatoula think of this as a small town. I certainly do. It's growing fast, but even in the 1970s and 80s, when I was a little kid, it had much more than one stoplight going on. So Albany's even smaller. It's a neat little community. Tell us about it.
Yes, absolutely. So, growing up in Albany was great. It was very family oriented because everyone knew everyone. You
Right.
didn't, the kids growing up, we didn't have to be concerned about what parents are concerned about today, because you went to everyone's home. You went home, you did your homework, and then you met at a certain place, and everybody got together to play in the evenings after school until dark came. And school life was great. I was into lots of sports, not only with academics, but just being able to be a part of the dance team. Everything was just really just family oriented. Everyone knew everyone. So that always makes things so much better.
That's one of the things that I loved about my childhood here, was it seemed like everyone knew everyone. Now looking back, I don't think that was probably possible even in the
Yeah.
80s. But I know just in my 44 years that's been one big change around here. You know, and it was never clearer than that proud moment when we went to the Dome, when Coach Hank Tierney coached those awesome young men, and we went down there to play for the state championship, and it was so great and such a moment of pride for Ponchatoula. But it was a bit humbling for someone like me who considers myself here, you know, in the center of town, to be kind of a man in the know, so to speak, to look around and see so many people that I had no idea who they were. And of course they had no idea who I was, and realized that, man, this place has grown a ton, and we're not quite that tight knit community we used to be.
Right.
So it kind of is neat to hear you talk about the Albany experience, where you guys genuinely did know everybody. You could probably see a face and put it with a house immediately, because
Absolutely.
there's not that much going on. And I know my wife would be tickled to hear you bragging on the school system over there. She works in the Livingston school system as a clinical social worker. And while she's not assigned to Albany schools, her friends and colleagues are, and they take great pride in what they're doing over there. And she's had cousins and, you know, many family members go through there. Her mom lives near there, or grandmother. So that's cool. Well, you know, you mentioned family, and so I want to share here a comment, if we can, because our viewers may be delighted to hear that you are Adariana Evans' mother. She is one of our most popular and best liked Ponchatoula Live guest. I just loved my interview with her. I really enjoyed getting to know her, and I got tons of great feedback about that show afterwards. So you see, she commented here, "Hey, Mama." So Adariana, thanks for chiming in, and thanks for watching the show again. I see you giving your mom a lot of love, and that's really cool. She is not the only person, Pamela, giving you some love here. Crystal says, "Hey, Pam." Crystal, thank you for watching the show. And she says she loved working with you in ministry. I can't wait to ask you more about that. We're very eager to learn about that. And Patricia also says, hey, my button. I like that.
That's my sister.
That's your sister, huh? Well, it's good to have great family watching. Miss Patricia, thank you for tuning in. I love the picture of that little baby. I don't know who that is, but they sure are cute. That's cool. Folks, we are here with Pamela White, and she's a wonderful woman, and we're looking forward to getting to know her better. And as you just saw, we have the ability to bring your comments live here into the show. So if you're watching this show live and you want to ask Pamela a question or show her some love, as people have already done, just leave a comment below. I'll do my best to get it up on the show, share it with her and the rest of you viewers. So thank you so much for tuning in. We've been talking a little bit about growing up in Albany, what a great experience that was. Tell us about the transition. You know, you crossed the parish line from Albany to Hammond to go to Southeastern, first person in your family to go to college. Tell us about what that was like, and just please, you know, describe the experience for us.
Yes, absolutely. So it wasn't the easiest experience or process for me, because what I didn't mention was at the age of 8, my father passed away, and 8 years later, my mom passed away, and I was 16 years old. And so it was challenging. And so I think for me, it just made the drive, my intuition, you know, just to be a little bit stronger, because it came a time to where I had to decide, would I finish high school at Albany, or would I transfer to Zachary, which is where my oldest brother lived. And I did not want to leave my school, because I was a hornet for life. And, you know, just because, you know, I loved everyone there. Everyone knew everyone. It was going to be a hard transition for me, being that I only had one more year of school. So I was able to drive from Zachary, Louisiana to Albany almost every day. Sometimes I would stay with other family members, but you know,
wow, that's a trek. That's a serious drive. Wow, that takes commitment. You're right. You loved your Hornet for life status to do that.
Yes. And so, I was able to do that and then transition. It was a few years later before I actually started college at Southeastern. And what I didn't mention also was my first degree was actually an associate degree.
Okay.
Because I waited a few years before I did get in school. And once I obtained the associate degree at Southeastern, then I went back and got my bachelor's degree. And so it was just good. been able to transition into something. And what I actually started school as a non-traditional student. So there were some years in between that before I did go and become a student at Southeastern. So, oftentimes I was in the classroom with students who were much younger than myself. And so it could be a little bit intimidating, but yet I was able to push through and obtain the degree that I started out for.
That reminds me of comments my mom used to share with us, because she went to school initially, like you. She came from a family that was not well educated. Her parents had not gone to college. Her older sister went on to be a teacher and went to college first. But the first time my mom went to college, she started at what's now University of Louisiana Lafayette, and she didn't finish. She went for 2 years and was tired of being poor, so she took a job and started making money. And she returned to school at Southeastern when I was a kid as a non-traditional student. And I remember her telling us about the experience that you had showing up older. Sometimes people would think she's the teacher the first day of class because she's the old one in the room. And you could kind of feel like the odd woman out. Like you, she went on to get a master's degree. Now you doubled her up. She's only got one. So getting two is incredibly impressive. But I can't imagine how tough that must have been after losing your parent. I mean, you mentioned this long drive, and certainly that was tough, but boy, the emotional impact. My dad lost his father at 16, and we've often heard about how tough that was, but his mom was still around, for another 50 or so years. So that must have been so difficult. I'm sorry for your loss, and I can't imagine what that was like. And it sounds like your siblings stepped up. We've got your sister chiming in. You mentioned your older brother. Tell us about your siblings. I know that there's at least three of you, but what was your family life like after that? And tell us about your brothers, sisters, etc., if you don't mind.
Yes, so my older brother was the one who actually took me in, and he moved from California and was in Zachary, and because he trusted, he there was a level of responsibility that I obtained, and so he wanted to make certain that I, kept up with my grades, a certain GPA. He put those standards there for me, and just having my siblings there, it was we all had different patterns or different paths, but when the time came, we would come together and make sure that things were actually taken care of. And so, just like any other families, we have some disagreements, but at the end of the day, family is family. And those are the things that my mom instilled into us. No matter what we go through in life, no matter how difficult it is, even for my mom, I knew it was probably difficult for her having to raise children and provide, not having our dad around. But those are the things that she left for us. And as siblings now, we have those things to kind of hold tight and hold dear to.
Wow. What would you say you learned from your siblings? You got your brother, Patricia. I'm sure you mentioned family is family. Everybody's got issues from time to time, but it sounds like your brother did a great job of instilling standards and a work ethic and an expectation of accomplishment in you. What other lessons do you feel like you learned from your siblings?
I would have to say that all of them are hard workers. There's a drive in them, to when there's something that is before them that they want to see accomplished, they push through, even though during those hard times, just being able to push through, not knowing that everything, we were a family where we did not have the silver spoon in our mouths. So we understood that there were things that if you wanted to obtain in life, you had to work for them. And sometimes you had to work harder than others to obtain them. And so that's one of the things that I would say that my siblings have shown me, is that you work hard for what you want, and you'll obtain that.
Mm-hmm. So we've talked about family. We've talked about growing up in Albany, the tragedy that struck your family, losing not one, but both parents, how your siblings stepped up and you guys united to get through things. And then you go off and do something unprecedented and go into college. And it's not the easy, like you say, there's no silver spoon, I think you said.
Yeah.
So you weren't like a sorority girl who was off there with Daddy Warbucks paying from afar. It's kind of a hard scrabble, determined path to education, starting with an associate's degree, then a bachelor's degree, all at Southeastern. What's the next chapter in life for you after you graduate from college? Did you go straight into graduate school, academia, or did you take another path? What came next?
After I finished with my associate degree, I started working at North Oaks, and I actually worked at North Oaks for 16 years. Being there with my associate degree, I went back and obtained my bachelor's degree and worked there with some amazing people. I became
And
the
North Oaks, that's a big place. I think it might be the biggest employer in the
yes.
parish. You know, what department, where'd you work and what did you do?
So I actually started out in rehab, and from there I moved to physician services and administration, and I was the executive assistant to the chief medical officer, Dr. Robert Peltier, for 8 years. He's an amazing man, an amazing doctor. Even though I'm not there.
Thank you for saying that. And folks, you can learn more about that amazing man, an amazing doctor, by checking out his Ponchatoula Live interviews. So shameless plug alert. Check out our video section. You'll see an interview with him. And Pamela is right. He really is an impressive fellow.
He really is. He has not changed. I can pick up the phone right now today and call him for something, and it is though I've never left. And he made my job there easy because he was an easy person to work with. And so that's where I was for about 16 years. And from there, I moved on, and now I'm a part of Tulane University, where I'm the clinic manager for a neurosciences clinic.
Oh, wow. That's really impressive. Chantel Lewis says, hello, Miss Pamela. So I wanted to make sure we share that with her. That's really impressive. You know, I'm a Tulane guy. My dad's a Tulane graduate. That's where I went to school. Been a big fan. So I can't wait to hear more about that.
Yes.
And hearing that you got started at North Oaks is really neat, because it's, you know, it's the unifying healthcare story of our area here, right?
Yes.
Both of my kids were born there. Everybody seems to have a story, you know, been through the ERs of the world. And there's just some really great people working up there: doctor, nurses, support staff, custodial staff, etc. In fact, I've actively recruited some of my own staff from there. You know, I went and coached a couple talents that were there approximately 6 years themselves, and brought them here into our firm, because as injury lawyers, we deal with injured people, and it's important to us to have folks with a long track record dealing with injured people. And that's cool. So it kind of tickles my heart to hear that my old alma mater, or the Tulane doctors associated with that great university, recruited you to run that clinic. So, you know, you've got 2 master's degree, you leave North Oaks, you go to Tulane. Tell us about that career. Tell us about your clinic, what you do, the services you guys provide. I happen to know, because of my line of work, y'all employ some of the very best doctors and other professionals in the state. And our people would love to learn about it, because you're not that far away. So, you know, please tell us about Tulane Neurosciences.
Yes. So I have been the manager at Tulane for almost 4 years now. It was a brand new clinic, and I had the opportunity to get in there and get the clinic started up, get it running well, get it off the ground. And we have some amazing doctors. I have an amazing group of staff, front desk people and nurses. We do a great job of taking care of our patients. Every single one of them that comes in the door, we strive for patient satisfaction as well as patient excellence, and making certain that our patients receive the greatest quality of care that we can possibly provide. We have neurosurgeons in the clinic that do, one of them specializes in spine, and he does minimally invasive procedures, whereas you can actually be up and moving the very next day, even after having a spine surgery. We have doctors, another neurosurgeon, that is Dr. Thomas Francavilla. We have Dr. Robert Della Piazza, who actually deals with things that is related to the brain. And so it is amazing how they are able to implant stimulators into the brain for those patients who are dealing with Parkinson's or tremors or anything along those lines, that they're able to implant stimulators to where there were shakes, they're able to control the shakes. As well as neurologists, we have Dr. Rana Abousoufé, who is a wonderful provider who takes care of seizure patients, epilepsy, and any type of neuromuscular diseases that you have. So if you have tingling, yes.
I'm sorry, I'm getting the impression you need 2 master's degrees just to be able to spell and pronounce the names of your doctors. I'm impressed already. 3 doctors in, so keep going. That's good.
It took some time. It took some time. It
I
took some
bet. I
writing on
bet.
Post-it notes to get it. Yes, and so she takes care of anything that is neuromuscular,
Uh-huh.
any kind of tingling or anything that deals with your muscles. And then, of course, we deal with general neurology, that's stroke, that's headaches, migraines. We have one of our providers, Dr. Sarah Perez, who deals with the Parkinson's, the Alzheimer's,
Hmm.
Parkinson's and tremors and dystonia, the jerking of the neck, any
Right.
type of movement disorders that is going on. And then we have Dr. Dimitri Maraganore, who specializes in brain health. And this is so intriguing to me, especially if there's anyone watching, that if you have a history of Alzheimer's or dementia in your family, there is preventative help that can be done to help you stay on the right path, so that could hopefully, prevent you from having some of those same things that your family members may have had to deal with.
That's so important because those are just terrifying afflictions that you've described. I've seen some in my family, and of course, friends with others. And my wife suffers from epilepsy, and she had a couple seizures, while pregnant with one of her children. And thank God everything worked out. But it's terrifying when you're going through
Yes.
that, and I know I've heard her mother describe how terrifying it was when she first started having seizures, and how stressful it was before they kind of figured out what they were and what type they were. There's a million, it seems, types of different seizures, and
Yes.
so that's so important. And I think it's really neat to see that right down the road, because as an injury attorney, much of what you described, the spine surgeon and unfortunately the brain surgeon, all the traumatic injury type stuff, headaches, migraines, even when they're traumatically induced, etc. These are things that are frequent in my clients. And I know that when I began my practice, became a lawyer in 2002. But in the good old days, if you will, you kind of had to go into the city to find specialists like you've described.
Yes.
We didn't
Yes.
have neurosurgeons in this area, or neurologists, and certainly not an abundance of super specialists as you've mentioned. So it's pretty cool to have that right down the road on the North Shore, rather than having to drive into downtown New Orleans or maybe
Yes.
to the actual main Tulane campus, if you will. So that's cool, and it's really neat that they've entrusted you as a local person to run that. So that's
Yes.
really cool. What do you love about your job? What when you talked about this, and you're talking about all these doctors with their fancy degrees and even more complicated names, it seems, your face lit up. So clearly you like what you do. Please tell us what it is you like about your job.
I love the fact that my administrator gives me the liberty to make, to run my clinic in a manner that's going to bring success to Tulane and make Tulane's name great. I love being able to go, because one of the things for me when I was looking for staff, I knew exactly what I was looking for. I knew who I wanted to be at the front desk. I knew what kind of personality. And so just being able to have the liberty and the freedom to structure the clinic in a manner that I see that it will be successful, it helps me to get up every single morning to go to work.
Yeah.
There are no, oh my gosh, I hate that I have to get up and go. I love going to my job. And not only that, that when we do, I mean, of course, I have to be honest and say that not every single patient that comes to our clinic is satisfied.
Well,
And
sure.
sometimes
And so
sometimes,
many of them are in acute pain. I mean, they're going through the worst stuff in their life if they're seeing a neurologist or a neurosurgeon. So
yes,
that's understandable. I don't think there's such a thing as a neuroscience clinic with a 5-star rating on Google. I mean, if they do, that's
yeah.
probably fishy, because folks are going through a lot. It's hard to be happy and click 5 stars when when you're having seizures.
And one, and I love the fact of being able to call those patients and say, can you tell me about your experience? And
Hmm.
helping them to resolve through it. And, and most of them who said that they were not going to come back are still our patients today, because
Yeah.
I want to make certain that every single patient that comes into that clinic is treated just like they're my family. It
Hmm.
doesn't matter what their insurance type is. It doesn't matter their race. I want to make certain that every single patient is treated the same. And that's what I love about being able to bring that patient satisfaction, to every single person that I'm able to communicate with.
You've described a tremendous responsibility, and I love your focus on patient satisfaction and patient care. What's a day in the life like in this job? I mean, I'm sure it's hectic and challenging, and but can you give our viewers kind of a glimpse of kind of a typical day sitting in your chair?
Yes, absolutely. So some of the main things I have to do is make sure that the daily operations are going forth, making certain that the physician schedules are taken care of. There are those times, especially, now that we're in the COVID days, sometimes we can wear masks and somehow we still we end up with COVID. And so it's unfortunate
Right.
that even when the staff gets it, that means sometimes that the way that the day is structured may have to change. We have to call patients and, move them around. It may be the provider has gotten sick. And so now we have to move things around. So that's probably, if I had to say, it's probably one of the most, it's not challenging. It's just, you don't want to have to move patients because they're scheduled because they need to come to see you. And
Right.
so that's probably one of the most, um, not so pleasant things that I like having to do is having to go in and restructure what the day actually looks like.
Yeah, I bet that's an incredible challenge, and you're trying to bring urgent and necessary services to folks that really need this medical care, while maintaining a level of satisfaction. And these COVID spikes are completely out of your control. What can
Hmm.
you do? Like you
Hmm.
said, even when you're masked up, you can catch it. That's got to be incredibly frustrating. Folks, we're here with Pamela White. She's so impressive. She's been telling us about what it's like to run a clinic for Tulane, the neurosciences clinic here on the North Shore, where they've brought world class neurologists and neurosurgeons to
Yes.
provide great services to people who need it. But she is much more than just a talented professional. As her daughter says here, she is a great role model. She's Dariana here says she's so proud of you. She's grateful to do life with you. Your sister Patricia says that you're awesome and she's very proud of you and she's throwing much love your way. Shona says that you are awesome and this is great information and she loves you, and also that you're truly like that in every aspect of your life. And Cheney says it's a very interesting interview and that you're very knowledgeable in your field. So thank you all for watching the show, folks. It's so great to see our viewers chiming in with such positivity. Some that know you and love you well, some that presumably don't know you, and so
Uh-huh.
that's really cool. You're impressive in many ways. And as I was mentioning to you before the show, off the air, one of the most impressive things to me is this incredible daughter that you've raised, who I had the privilege to interview a few months ago or last month or so. Tell us about that. Tell us about what it's like being a Dariana's mom and just motherhood in general. And if you will, for parents like me who have little ones that are coming up, any wisdom you could impart or secret sauce you could share would be much appreciated.
Yes, absolutely. So, Adariana is, I also call her Tay. Most people call her Tay, but now that she's growing up, she's taken on this professional name of Adariana.
Okay.
But she is a wonderful, wonderful young lady, has grown up to do great things. And I have to say that she was not, I actually born gave birth to two children. My son Darius, who recently was murdered almost 2 years ago.
I'm so
Actually,
sorry
it
for your
was two
loss.
years ago,
Wow.
just January 4th, 2 years ago. And so it's been great being able to bond with her and to be able to grieve with her, to be able to do business and ministry work with her. She's very supportive of me as I am of her. And actually today I sent her a voice message just because I wanted her to know just how proud I am of her, of being able to push through things. And, as a mom, we laugh, we cry together. And I
Cool.
support her, in every single thing that she does, just being able to raise her up and for her to watch me as a mom, I believe no doubt that it has helped to steer her in the right direction. I hadn't always made the best decisions all my life, but then,
Who
when
has? Nobody.
right, right. But I believe that some of the decisions that I have made have certainly been impactful to her as growing up to be a young woman. And I believe that is what has imparted so many great things in her, is just been able to watch me as, you know, as a mom, being able to do life, go to school, go to work full time, you know, and knowing that it hasn't always been easy. I mean, and we've had some hard days, you know, coming up financially. And she saw how, you know, between her father and I being able to push through, you know, and get things that now we're able to experience a much better life.
She saw you overcome all those tough times, and it
Yes.
strengthened her and taught her. And it reminds me of my own mom and dad, but you know, the examples they set. And you know, we talked earlier about your shared background with my mom of being a non-traditional student and working through school to get higher education. And you know, I'm one of 4 boys. 3 of us are bookworm nerds that were always great at school. It came to us easy. We all went on to become lawyers, and it was never a huge challenge. My brother Bree hated school. And it took him 12 years to get through college. Now, in fairness to him, he was working full time as a cop the whole time. He didn't go do the lazy frat boy routine the rest of us did. But I really believe in my heart of hearts that watching my mom struggle with calculus at 40 years old, going back to school and not having studied math in decades, really gave him the strength and resolve to stick with it for over a decade, so that his little girls and stepsons could see him graduate school. And here we are now, you know, like you, he's pursuing a master's. So hopefully he'll join you in that master's degree rank soon. And it's that example as a parent that's so important. So I really appreciate you sharing that. I am, of course, as I expressed to your daughter when I met with her the first time, so sorry for this profound loss you've suffered.
Yes.
I cannot begin to imagine how tough that is. But I do notice that you have turn the grief on its head to be so productive for our community in a way that you're helping others through grief counseling. And I lost my childhood best friend to murder over 20 years ago when we were in college. Just took my boys to visit his gravesite last month, you know, during this Christmas break. And, you know, I watched his parents endure that for so long, and can't begin to imagine how tough it is. But tell us about what you've done through your ministry, through grief counseling. You seem to have really, you know, made it your mission to help people through loss and grief. And it just, I'm so amazed by that and impressed by that. And could you perhaps share with us where the strength and idea comes from to do something like that?
Absolutely. So, as you stated, of course, it is something that no parent, no person should ever have to go through, especially dealing with murder. And it was the most horrendous time of our lives that we had to endure that for over a week period until he was declared there was nothing more that could actually be done. And I could remember I am a woman of faith. That is where my strength, that is where my help, that is where that is where I get everything that I need to be able to endure, to do life just in general. But during that particular time, that is where my faith was actually put to test. And I can remember the very morning that we were getting ready to bury my son. It was probably about 4 or 5 o'clock in the morning. And, there was God spoke to me and he says, okay, so this is what you're going to be doing to help other people. You're going to help people. You're going to talk to them. You're going to show them where you get your strength from. And he, you know, just basically said, you know, you will not grieve the way everyone else grieves. I'm going to show you how to do it differently. And I felt like I felt like he disregarded me. He disrespected me. I just felt like he slapped me in my face. And I'm like, you got to be kidding. Like, we have not even buried my son. And you're telling me that I will need to help other people grieve, and to grieve properly, and to grieve with grace. And so I felt insulted. And here probably 2 months later, I met with ladies in my home, mothers who had lost their sons or their daughters. And we just sat and we talked. I have to say that I'm not a counselor, but I am a minister. And so I am able to share with people through the word of God of how we can overcome some of the most difficult times in our lives. And it's one of the things that I have been standing on, and that has been sort of like my motto is God rescued. I was rescued by grace, you know, and it has kept me. Even in those moments to where I felt like I should be responding differently. And that didn't happen because I have been able to show other people by them just watching me and without me even knowing who they are, that you can grieve differently. Not saying that it doesn't hurt, not saying that we don't cry, not saying that we don't miss him, not even saying that we don't get angry because of what happened, but we're able to manage and do life and do it in a healthy way. You can grieve healthy. And so that's what I've learned to do, to grieve in a healthy way.
So what does grieving healthy mean? What goes into that? What's the process? How does that work?
It means for me, I set boundaries in the beginning. I told my friends, I told my daughter, if I am in the bed for too long, too many days, like I felt like I deserved some time to be able to do nothing, to sit, to cry, to lay, to sleep. But if I'm in there for too many days, you tell me. And because I trust you and because I've given you permission, then I'm going to listen to you. So that's a part of healthy grieving. Healthy grieving is you may need to set some time aside to say, you know what, when I come home, I just want to sit and I'm going to reflect and I'm going to cry. You know, and so it's whatever it looks like to you. But unhealthy grieving is not doing anything for yourself, just giving up on your own life. It's bad enough that you've lost a loved one, but to say, you know what, now I don't want to live anymore, that's unhealthy. That's not, you know, and if you were able to speak to your loved one, I am certain they would not want you to grieve unhealthy. So it's just setting those boundaries, being accountable to other people that you trust, that you love, and you know they love you. You know, being able to get help. Counseling is okay. It's
Right.
okay. And I
Amen.
have to say that, especially in the African American culture, that is something that we have shunned away from for years because of the stigmas that's been placed on them. But it is okay. I went to counseling, you know, and I did it not only for myself, but because I may be able to help my daughter, my husband, you know, or another family member. So counseling that helps you to grieve healthy, and you know, in a very healthy manner.
I appreciate you doing your part to combat the stigma associated with counseling because it's so
Mhm.
important. My wife's a mental health care provider, as a clinical social worker, and I know how important that is. And you're right; too many people put a stigma on that. And your daughter put something here that I'd like you to comment on. She says, "Being there but not staying there." Why don't you help our viewers understand what that means?
Absolutely. So, you know, for us, when we dealt with our my son, her brother's death, is we understood that he had passed away, but we were not going to stay in that place. Like we gave ourselves room to grieve, to cry, and say, okay, you know what? If it happens, I'm going to roll with the waves. I'm not going to stop it. I'm not going to say, you know, don't cry. You know, we dealt with it moment by moment and not staying in the place of grief, be able to give yourself that time. But after a certain period of time, you have got to learn how to move on, even if it's a little step at a time, even if it's just getting up out of the bed but still staying in your pajamas. Okay, then you've done something a little different. Okay, so now you're not
Right.
staying in the bed as long. Okay, so now you're getting out of your pajamas and you're actually putting on clothes, but you're still staying in the house. You're making some steps of progression, and that's what happens because depression will set in so quickly that you don't even realize that it's happened. You know, and anxiety, dealing with those things that sometimes we don't feel is real. You know, those things really exist, and it's been able to tap into what is really happening, so that you can admit this is where I am, so that you can move out of that place.
Yeah, Patricia says that you taught her how to move on.
Hmm.
Clearly, you've learned so much from this. To the viewers who may be going through something similar, or
Hmm.
think about folks in those dark places that can't get out of bed, or maybe today's their first day out of bed and they're still in their jammies. What have you learned that they could benefit from, and what advice can you give about how to get from that deep dark hole to where you are? I know it's not one easy leap. There's no easy button when it comes to grief, but there might be somebody watching right now that you could really help, who's at that low point. Maybe you tell us how to reach out to you, to contact you, to get you and your group involved. Maybe it's just what to do, but what advice would you give to somebody if they're watching from that low point that you kind of described?
Yes. So I think what's important is to be able to communicate how you really feel. Sometimes
Mm-hmm.
people don't like to talk about their feelings, and that's what keeps us trapped. It keeps us in an entrapment to where we can't break out of where we are. And so I think it's very important to be able to communicate. Have someone. Everybody needs a circle. I'll
Mm-hmm.
tell you, as much as a woman of faith as I am, I had some low moments. And if I didn't have a circle of friends that I could depend on, to where I could text them and say, hey, I'm not doing well. They didn't ask me questions, but they knew what that meant. And they would encourage me even through words of prayer. And so I think the first thing is have a circle of people that you can depend on. If you don't have anyone, then I think that's important. Is sometimes we isolate ourselves to where no one wants to come around us. I think it's important that we get connected with people, because we need people to help us to overcome some of the things that we're actually facing. And I think one of the other things is admitting and realizing that it really happened.
Right.
That they're no longer here, and how and try to incorporate some steps of how do I move from here. And that may mean you need to talk to someone. That
Right.
may mean that you need a counselor. Because we have to admit that it has really happened, that it's not a fairy tale, that it is reality. And
Mm-hmm.
the quicker we can learn how to do that. And I think that's what's important, is sometimes people don't grieve because they're too busy trying to help other people. Take care of yourself. Take care of yourself. That's important, because I've seen where people have not grieved for years because they were too busy trying to be strong for other people. It's important that you take care of yourself too.
And I think you have to shore up your own foundation and take care of yourself first, so that you can take care of other people, because
Absolutely.
you're not going to be good for them if you're not where you need to be. You mentioned your circle of friends, the
Mhm.
importance of the people in your life that support you and help you when you're at your lowest point. What advice would you give to friends of people going through something like a murdered son, daughter, brother, sister, etc.? Folks like me that have not been through that, cannot imagine that, want to be there for our loved ones if we see them going through it. But frankly, we don't know what to do, how to do it. What advice would you give to us?
And I would say not even just for someone who has been murdered, but just death in general. Most often people want to stay away. If you were in
Right.
a close relationship with someone, don't stop. Don't shy away. Don't stay away. It doesn't mean that you have to talk. Just your presence alone sometimes mean a lot, because if you were there prior to the death, you need to continue to be there. And that was something that I shared on Facebook probably a couple of months after my son was no longer here. Is I made a post just letting people know, hey, if you had a relationship prior to, you continue the same thing. If y'all were going out to eat, you ask, even though if they may say no. I know for a period of time, I didn't want to go anywhere. I didn't want to do anything. But then I picked back up and I started going back out to eat with my friends. So whatever
Yeah.
you were doing before, you need to continue to do that. If you were a hugger before, continue to hug them. Don't, if you were texting before, continue to do that. Whatever you did before, that person needs you now more than they needed you
More than
before.
ever. Yeah.
Mhm.
There's I couldn't do it justice. I don't remember it exactly, but there's a great old story about Huey Long when he was governor, going to a legislature, and he told something like, "Well, I just can't be with you on this one because you're wrong." And he's like, "No, this is when I need you. It's now."
Yes.
It's like, so the
Yes.
notion of being there for someone when they need you more than ever is a powerful one. And it sounds to me like there is no magic formula. There are no magic words. You can't do anything, and it's not a Harry Potter movie we're living in that's going to bring somebody back, but you can be there for your friends and keep things the way they've always been between you,
Mhm.
supportive wise. So that's really neat. Before we move off that topic, Tell us a little bit about your circle of friends. You clearly have people in your life that have helped you and that you love. I can see it in your face. Why don't you
Yes.
tell us a little bit about them?
So during that particular time, my friends, they actually would come to the hospital every single day because we were at the hospital for 7 days straight. There was not a day that went by that they were not there. And my friend Cassandra Cotton was there. Dr. Shannon Finley, that maybe most people know her by. One
Yeah, hey,
lady.
you know what? Shannon Finley has the record still. She and her husband had the most views ever on a Ponchatoula Live interview. And
Uh-huh.
she's near and dear to my heart because she donated a bike to my Bike for Kid program. But wonderful
Uh-huh.
woman. Yeah. Sorry to
Yeah.
interrupt you, but I got
That's
to give
okay.
Dr. Finley some props. She's awesome.
Yes. My friend Tessie Bear,
Hmm.
who we have been praying together for well over 10 years now. So it was people that were, when I was weak, they were strong and they were able to hold me up during those dark times.
Yeah.
During the times of, preparing for the services, there was very little that I had to do, because of them and because of family members stepping in and doing things. And so that made the process, that made my time of grief so much easier. And I understand that not everyone has that. And so it makes it a lot easier when you do have people that you can depend on. And so it made my process so much easier, and having my church family, my pastor was very supportive. I could not have asked for a better pastor during that time of grief, because if he wasn't there every day, it was every other day, and making certain that we had what we needed, because of course we were not coming home, we were staying in Baton Rouge, but just making certain that I had what I needed. And I am forever grateful for every single person. People were sending us money, just and that matters,
Yeah.
because you don't think about it. And I was asking someone, why are people so nice? And they had to remind me, Pam, you've forgotten the things that you have done for other people. You forget how much you give of yourself to so many others. So this is the moment that you need it the most, and people is just pouring back into you.
Yeah. Well, hey, speaking of that, they're pouring love for you right now online with comments. So you can see Crystal here says that you are an amazing woman with a heart for the people. Crystal, thank you for sharing that and for
Thank you.
watching the show. Patricia says, Michael Evans says, go, baby girl. Your daughter is Dariana's throwing more love your way. I think we may have posted. Patricia says you strengthen her every day. But look, you're getting love from all over. Crystal, Chantel, Keisha.
Thank you all.
I mean,
Thank
it's
you.
just it's everywhere. Just all over. So, folks, thank you for sharing your comments. Keep them coming.
Yes,
We've got a
thank you.
wonderful woman here on the show, and you have described yourself, Pam, as a woman of faith.
Hmm.
And I know from off-air conversations how important your faith is to you. Tell us about your faith journey. I mean, starting with, were you raised in the church? When did you come to know the Lord? Tell us a little bit about your faith journey and what God means to you.
Absolutely. So I started out attending church basically by myself as a little girl in Albany, where I attended Sweet Home Baptist Church. I was there up until the time that I moved to Hammond. And from Hammond, for the past 20 plus years, I've been at First True Love World Outreach Ministries. And when I started out there, the church, my pastor, Carl Coleman, he wonderful and amazing teacher. And and one of the great things about him is that he has been supportive of me the entire time that I've been there. And I feel I've done some amazing things in the church. It's been my faith is my strength. It is how my
Hmm.
life is structured. It is my motivation. It is what empowers me. It is what fuels me. And so just being able to give back to the community, I believe what I missed is now what I'm ready to, is what I'm always so willing to give back to this community. So faith is definitely, it's my foundation. Like,
Yeah.
I love it. I love the fact of being able to encourage people, to inspire them, to empower them, that there's so much more, there's so much more potential. And so it's my fuel. It's my
Hmm.
lifestyle.
Yeah. And you have found a great home there with Pastor Coleman. He is
Yes.
someone that we hear about often. He has long been a very influential leader in our community.
Yes.
He is beloved both within his congregation,
Yes.
and from beyond. And you can probably better than I describe why. So for our viewers, what is it you love about Pastor Coleman? Why is he so great at what he does? Because that's something I keep hearing. And from, I remember my dad tells me how much he respects him. My brother Bree, and other people that go to church there. He's just really well known. So tell us about him and his impact on you and why you have been there so long and love participating in that church.
Yes, absolutely. He is the most humble person that you will ever meet. He's understanding. Not only is he understanding, but he's there. He's present. And often that's what matters to me is when you need your pastor, you need them to be present. You don't want to
Right.
have to go through so many people just to get to the pastor. And so he has shown and proven himself to me and my family over the 20 plus years that we have been there, that he's been faithful to us. He has been consistent. His word has not changed. And just his demeanor, it's the same no matter where you see him, whether he's in the church or outside of the church. He is the same man every single time that you see him. And that matters in this day and time because so many other people,
Absolutely.
they change. And
Yeah.
he is not one of those. He's consistent.
Well, you think about how many idols, mentors, leaders have we been disappointed in the
Right.
last, few decades? I mean, the list is such a long one. So to have somebody that you can respect and keep respecting year after year, decade after decade, that's something special.
Yes.
Your life story is amazing. It is
Thank you.
inspiring. Your point of view, your resiliency is so impressive. I can't tell you how impressed I am by it. We have heard this story evolve from a little girl in Albany,
Mhm.
humble beginnings, parents that didn't go to college, and the tragedy that had struck you at so many points, losing your mother, your father, your son. And what I see is a woman who keeps bouncing back,
Mhm.
strengthened by God and this, faith. What are your viewpoints for the next chapter? I mean, where do you see this going? You seem to be kind of on top of the world with this great job, this great daughter, all these great things going on, great church. Where do you see life taking you in the next chapter?
So I enjoy being able to empower others and lead others. And so that is my passion, has been for a great time now, and which is, one of the ministries that God has given me called Empowering Kingdom Growth. And the motto is keeping the heartbeat strong. And we do that by empowering others, speaking well of others, giving, making certain that people have what they need. And so that is what my focus is, for the next generations to come, is to continue to empower others to do well, to continue to impart in them that you can be and become whatever it is that you set your mind out to be. It doesn't matter. There's no age restrictions. There are no things that could stop you other than yourself. And so that's what I'm focused on at this moment, is just being whatever it is, being wherever God intends for me to be,
Yeah.
and being present in that moment and being my very best at whatever that moment is.
That's inspiring. That's wonderful. What's the best way for someone to reach out to you if they were interested in getting you involved, to speak to their organization or help their person in need, or just whatever? What's the best way for folks to get you?
Yes, absolutely. So I am on Facebook as Pamela Evans White. You can send me a message there. And there is the ministry Facebook page, which is called Empowering Kingdom Growth, where you can see some of the things that we've done over the course of time, as well as I do not mind giving out my phone number. So if you need to reach me, because I understand that people do need people. And
Right.
so I am available to help you at any state that I can and at any cause that I can. I want to be able to get you whatever resources you need, because if you're willing to reach out to me, then that says to me that you want help. So I can be reached at 985-687-9214. And I'll help you to get whatever resources I can to get you the help that is actually needed. And I just wanted to share with you that I do this thing. It's called grief gatherings. They're real small gatherings. It's where people who are dealing with death, it doesn't have to be something tragic. It's just death in general. It's not just children. It could be your mother, your father. It doesn't matter. And we do that every other month. So the next one is going to be coming up in February. And I'll have that date posted. I'm getting ready to finalize the dates, but it will be in February.
And where do you do that?
We do. We're going to be doing them at the Hammond Recreational Center.
Okay.
I was doing them in my home, and I kind of stopped that. And of course, I can't do it now. But we will be at the Hammond, the Michael J. Kinney Center in Hammond.
Right. Well, I want to thank you. This has been compelling. And before we go, folks, I promised her I would get Mrs. White, Pamela, out of here on time because her day does not end right now. She's got more good to do. She's got nonprofit meetings and community service coming. But before we go, Pamela, what else would you like to share? Is there anything else on your mind, on your heart, anything you want to share with our community that you think we would love to hear?
Yes. So I want you to know that I am, as hopefully you could tell by now, that I am very passionate about the things that I do. Whether it is, I never thought that I would become so passionate to help people process grief. And that's where Grieving with Grace came from, because there is God's grace is sufficient. He has enough grace for every single person. And so, I have become so passionate about making certain that we grieve in a healthy manner. And it doesn't matter. And the thing about death is it has no discrimination. It doesn't matter what your color is, your race. It doesn't matter a denomination. It doesn't matter your age. It doesn't, your social status. It doesn't matter. And the thing about it is that I am so passionate about seeing people overcome dark places, hard places. I'm so passionate about seeing people be the very best that they can possibly be. That, that's why I'm here, is because every single thing that has been imparted into me, I want to impart that into others. I want to share. I'm not selfish. I want to see everyone do great as long as you want to do great. And so I just want you to know that I'm here in this community to see this community grow. I'm a part of it. So as you do well, that means I'm doing well.
Well, thank you for sharing that. This community is a better place because you're in it. And I'm so grateful that you shared again of yourself by talking with us here today. I'm certain that people watching this will be inspired and that they've loved. I mean, you could see in the comments, people have loved getting to know you or getting to know you better. So thank you for your time. To our viewers, thank you for tuning in. Ponchatoula Live will be back next week, same time, same place. And until then, have a great week. We'll see you then. Bye-bye.